Good day once again. My name is Oluwafemi and I'm the team lead for Acthub Africa. At Acthub Africa, what we do is to raise active citizens through our project and programs. Today, I'll be talking about something very salient, something very important to all Nigerians, and that is the priority of Nigeria government in the past 8 years in the area of health. Through the budget, if you study the budget very well, you will realize where government is placing their priorities through the amount or the percentage they actually allocate to that particular sector, either in education, health, infrastructure, security, or whatever area that you want to focus on. But today, I'm focusing on health priorities of Nigerian government in the past 8 years. It is important to know that Nigeria was one of those countries that made commitments in 2001 at Abuja Declaration that they're going to budget 15% of their total budget to health. Of course, 15% should be the least according to that commitment. But today, where are we in Nigeria? And that is why I'm bringing up this analysis. In 2014, the budget allocation was 6.8%. And in 2015, the budget allocation rose a bit to 6.9%, which was the highest in that trend. In 2016, the allocation dropped to 5.8%. And of course, in 2017, there's no wonder anyway, it dropped again to 5.1%. And in 2018, it rose again to 5.8%. And in 2019, it actually dropped very drastically to 4.2%. A year before we actually witnessed what we call COVID-19 pandemic. In 2020, we had our budget around 4.3% of the total budget, which means the allocation to health was so small that it cannot accommodate the type of pandemic that befell the whole world around that time, Nigeria inclusive. Despite the reports here and there that our hospitals are not equipped, drugs are not in the hospitals, we have shortage of personnel in the health sectors, we still went further down in 2021. There are questions that need answer. Questions such as, are we prepared for any pandemic? Are we actually working on improving health in this country? Is it that the masses is not actually in the plan of Nigerian government? Another question, very salient question we need to answer is the federal government actually budgeting any amount for COVID-19 vaccine? Is it that we are just waiting on countries around the world to give us free vaccines? In one of the research that we made, we realized that the number of deaths in Nigeria today through malaria is higher than the number of people that died through COVID-19. And therefore, we should see malaria as one of the health crises that we have in Nigeria. The question should be, what is the federal government doing about this malaria pandemic? At this point, we are not here to actually criticize the government. Our job is to call the attention of government to where they need to actually improve. And at this point, we want to say, the government needs to do something in the area of health. If we can actually not go beyond 50, at least we should hold on to the commitments made in 2001. Because Nigeria was one of those countries that signed on to that treaty, that signed on to that commitment, that they will budget, every country that are present will budget 15% of their total budget into health sector. At this point, I want to say, at Acthub Africa, we would like to beg the government to do what is right so that the masses can actually have access as one of the major goals of the Sustainable Development Goal. At this point, I want to say thank you for coming on this page once again. My name is Oluwafemi Olla, and I'm the team lead for Acthub Africa. Thank you very much.